this off. And give me this tripod. Take this off. Because that's just this.
You can do it now.
I don't know if that thing comes over here. This one. But for now, this is fine. It's plugged in.
Y'all should be a little scared of this visual.
No.
Why?
Next, can you just wait till after?
Has it?
Did you wait till 6:30?
You know, it's almost the weekend, right? You can wait.
We're out of Mountain Dew.
Yeah.
Scary visual.
Or it's tired.
So what were the 10 unpopular things that you thought were?
Oh, there was something on there and I was like, what the heck?
Did you do the unpopular Facebook thing, the 10 things that are unpopular? It's people have been doing it. They're like, it's like things that everyone likes that you don't.
Oh, Game of Thrones.
Yeah. Don't like. I've never seen Game of Thrones.
And Avengers.
I like the Christopher Nolan movies.
I try to watch Game of Thrones. I don't have that attention span.
That's why.
It's too long, it's too much sitting.
I had board games on there because I don't have the attention span. to
For
sit
board
through a
games?
Board game.
Board games are interactive though, you're like, oh, sorry, especially if you play sorry, you get to make them go back to home.
I gotta move around. I can't sit.
We have that in common. But I can play board games though. Come on, those are interactive, when you're the thread.
Like Monopoly.
Oh, we haven't had a Monopoly game.
Monopoly, I agree. So like, sorry.
Jump up, you like 20 jumping jacks a day right now. It's not an accurate.
No.
We do this week.
I'm gonna watch a lot of television, do a lot of walking probably.
Yeah.
Netflix probably. I mean, can't
I don't know,
believe
they took on the state parks.
I know we did Shelby Forest.
Yes, they're shutting down though, like all the.
Oh, they are.
Yeah.
Is that new today?
Well, my friend sent me
It
a.
happens tomorrow.
So that's Shelby Farms.
I said Shelby Forest.
No, Forest.
So my son is
Yeah.
And I really,
I've heard
I'm
such
really.
comments.
Yeah, I would have.
Oh,
What's
thank you.
funny Carter though?
Like on my Facebook page or whatever. Oh, okay, cool.
Shelby Forest is gonna shut down.
Oh, well,
That's
thank you.
county.
Got a big head now.
Me and my friend went to Arkansas.
But I like the Shelby Forest because there wasn't, it's so big, it didn't feel crowded, so you didn't feel like.
Yeah, Shelby Forest wasn't bad. I went on Saturday. Last Saturday.
Hills and Shelby Forest are like,
Yeah, that was a workout.
kids. That's not just like a stroll in the forest. That's like
Yeah, that's like-
kids. Like,
Yeah, that was my first time going and I was.
Yeah.
Wow.
We started talking when you're like going up this big hill and you're like, yeah, and then you're like, man, I'm out of shape. What's going on? stuff in the back, sorry. Hit it right back.
I totally understand. Not having that extra minute of dead air.
Let me stick you. Good afternoon, everyone. We'll go ahead and get started. We're right at 2 o'clock. Lisa Householder, Director of the Shelby County Health Department, and this afternoon I'm going to be joined by David Sweat, who's our Chief of Epidemiology, as well as Dr. Bruce Randolph, who is our Health Officer. I'm going to give a brief update and turn it over to the two of them, and then we'll open it up for questions. Our official count as of today is 640 cases. And I want to underscore, I use the word official. If you recall, it's the reports to the health department that are the official count. What we do know is that the hospitals received much more positives yesterday that haven't been reported to our system yet by the lab. So while we got 2 new reports from the conversations with hospitals this morning, they had about 60. So we anticipate an uptick tomorrow as a reflection of the lab sending the reports to us. We've experienced 8 deaths thus far in Shelby County. We've tested 7,157 individuals and still have a little bit over a 9% positivity rate. Tennessee currently has 2,845 cases reported. A few things I wanted to follow up on yesterday. There was a question yesterday about the additional hospital space that the Tennessee Department of Health is going to assist us with, and the specific question was whether those facilities would house COVID-infected patients or not. And I noted that typically individuals that are in those facilities are not COVID infected, but the state is really considering what are all the options. So I would just say that's a fluid answer, that it's possible some of those overflow facilities can actually be used for people who have COVID that are not needing intensive care space. So it's something to keep in mind. And then I will also reiterate what I said earlier, is that there are sometimes delays in the laboratory reporting to us, and there will be a catch-up of numbers as those lab results come in. So I don't want anyone to believe that 640 indicates that we're not continuing to incline on that epi curve. Our numbers are continuing to go up, and we anticipate they will continue to go up for some weeks to come. And there are key strategies that we can continue to take in our community to reduce the impact of that epi curve and to reduce the number of people who ultimately need hospitalization and ideally reduce deaths. So I want to focus really heavily today on social distancing. I'm going to ask David Sweat to talk about some of the data that indicates where we are on social distancing. And then Dr. Randolph's going to follow up to talk more about health directives from the health department, and then we'll open it up. Thank you.
So good afternoon, everyone. Back to the social distancing. There is a team of people working with the city and the county together that is looking at different ways of measuring the impact or the effectiveness of our safer at home, stay at home, shelter in place orders that have gone out from the municipal mayors and the county mayor, Lee Harris, as well as the health directives have been written by Dr. Randolph. So from a couple of different data streams, from the cell phone mobility data and from observation of comparing traffic at certain locations in the county, the traffic cameras, looking at before the orders went into place and after the orders went into place, what we see is we have evidence of about a 45% reduction in mobility. So we are operating now in terms of camera traffic and cell phone data traffic. It looks like about 55% of what the traffic pattern was before the orders went into place. That is good, but not good enough, because in order to really flatten the curve and prevent some future catastrophic impacts on our healthcare system, we need to get the number of people complying with the stay-at-home, safer-at-home, and shelter-in-place orders and directives above 60%. So we still have a lot of work to do there, and that is the most important thing that any of us can do, is limit our mobility in the world, limit the number of people we interact with, and as I've said before, what we are trying to do is starve the virus of new hosts, make it hard for the virus to find a new home. And we do that by staying put as much as possible in place. So we just continue to ask for the cooperation of everyone in the area to abide by these orders and only be out when it is absolutely essential for you to do so. And with that, I'll turn it over to my colleague, Dr. Brandolph.
Good afternoon. Today I'm announcing that I am issuing a specific order. This is the second health derivative to all non-essential businesses and establishments that they must cease operation effective tonight at 12 midnight. This means all non-essential businesses and establishments that are found to be operating will be closed by the Shelby County Health Department, specifically by me, the health officer. This order applies to all non-essential businesses and establishments, including entertainment venues, restaurants, places of worship, including churches, beauty supply stores, barber shops, beauty shops, salons, parks and recreation facilities, gyms, golf courses, tennis courses, swimming pools, spas, and other non-essential establishments. To the essential businesses, those businesses that will be allowed to remain open, I want to say a word to you. I'm requiring you to operate in accordance to the CDC guidance and guidelines and OSHA regulations. At the very least, you are required to ensure that your patrons and employees are safe. You have a responsibility to ensure that your employees work in a healthful and safe workplace. Therefore, in an effort to limit gathering and to promote social distancing, you are required to limit the total number of patrons in the establishment to 10 at one time, or ensure that the patrons are separated 6 feet or more apart. You're required to provide the appropriate personal protection equipment, PPE, to your employees and take steps to enhance personal hygiene of employees and to provide extraordinary sanitation to your facilities and extraordinary sanitization efforts within your facilities. I'm requiring all essential services, especially grocery stores and pharmacies, that they make best efforts to establish hours when only seniors and the vulnerable population can access the facility. These businesses must adhere to CDC guidance on social distancing and hand hygiene in the workplace, and encourage work from home and allow employees, when possible, to work on site in shifts to optimize social distancing in the workplace. To all people of Shelby County, citizens and those visiting, you are required to fully comply with the executive orders of Governor Bill Lee, Mayor Lee Harris, and all the mayors of the municipalities in Shelby County, including Arlington, Bartlett, Hardyville, Lakeland, Milton, and Memphis. You are to stay home unless you are serving in a position designated as essential services, or you are an owner or operator of a business that provides essential services to the community. You are to remain at home, leaving for essential services only, and avoid public spaces with the exception of outdoor spaces where there are 10 people or less and you are separated 6 feet or more. Essential services mean services and our businesses that the interruption of will endanger life, health, and personal safety to the individual or the population as a whole. We're facing a crucial period in this pandemic. It's serious. This is a life, a death moment. The actions that we take now will make a difference in the number of deaths that occur as a result of COVID-19. It has been projected that as many as 20,000 could die in Shelby County. We must not let that happen. We must do whatever it takes by any means necessary to not let that happen. So therefore, I'm taking these drastic measures in order to protect life and prevent deaths. So my fellow citizens of Shelby County, Memphis, the surrounding area, I'm urging you, and I'm pleading with you to adhere to this directive, this order. This is not a recommendation. This is not a simple request. This is a requirement. And we intend to enforce it. And so when I get calls and notification that businesses and establishments are violating this directive, I will come and I will close the business of the establishment. So fellow citizens, separate. Don't congregate. Stay home. For the life you save may be your own. Now we'll open it up for questions.
Does that mean restaurants, and carry out and take out?
Restaurants will still have their drive-through, but no congregation. I've gotten some calls where there have been some restaurants where folk were sitting inside the establishment. But people have to eat. And so drive-through, take and go, but no staying, no congregating, no gathering.
What about that for with grocery stores and places like that? Do they have to limit 10 people inside? Will that work for them too?
Ensure that there's distance.
Okay.
So size
6
of the
feet.
space is critical.
And who will be enforcing that? Is it the store itself?
Yes.
You
But-
still-
But also they'll call us if need be.
You
Right.
mentioned a projection that 20,000 people could die in Shelby County. Where is that projection from, and what is that? What factors is that?
That's
based
just
on?
some estimates as if the worst case scenario. We don't really have the exact number yet. Of course, nationally, they're talking about hundreds of thousands.
And I assume that would be if we don't take social distancing.
If we don't take this measure, and now is the time, this is crucial. It's estimated that within the next few weeks, we will have our surge. And so in an attempt to try to level the peak of the curve, I feel that these are measures we must take in order to do that.
Can you tell us about how many businesses you've had to shut down so far because of them violating these measures?
None at this moment that I have, but let it be known that today is the beginning.
Well, we
How
referenced,
if they're shut down?
can I add to that quick?
Mhm.
You know, we referenced Hobby Lobby yesterday, and Hobby Lobby, it's a good example of where we reached out and the organization voluntarily closed. So we want to try to reach out first and let organizations make decisions themselves to come into compliance, but then we can take more direct measures if need be.
And if they don't close, will you cite them? Will they receive some sort of fine? What will happen?
No, we will close. The health officer has the authority and the power to close any establishment that he perceives to represent a threat to the public's health. So if someone is violating this directive, this order, I view that as a threat to the public and therefore will exercise my authority and power to close it.
Could the business owners face some sort of citation or like misdemeanor though? Like,
Well, they could be subject if they continue to violate or refuse, then they are subject to a fine and a misdemeanor. I think the fine is up to $1,500 or $2,500, I'm not quite sure.
how do y'all plan on regulating some of the parks? You know, Shelby Farms is still open. Like, do you guys plan on having more people out and about to make sure people aren't congregating? I know also in Harbortown area along the river, a lot of people are still hanging out in large groups, and I know there's signs out there that say, you know, keep 6 feet distance, but you plan on having people kind of regulating that to make sure these people are keeping a distance, and do you anticipate closing it ever?
We have code enforcement as well as staff members of Shelby County Health Department who would monitor that. Even law enforcement has the power to break up gatherings and say, you all need to move on and separate. And I'm hoping that law enforcement will exercise that right and authority.
So Dr. Randolph, just to clarify, the safer place order's been in place for, more than a week. This is targeting those that have, to date, have not followed those initial orders and are still operating, correct?
Yeah, understand this, that many have adhered to. Many have been responsible citizens and have done what was asked of them. But there are some who either didn't get the message or did not take the message seriously. And we need to reiterate that this is a serious matter. This is real. This is not a joke. This is a life or death situation, and we've got to do something about it, or else we face numerous deaths.
Any word on another temporary hospital location to house the overflow of patients? I know you guys announced the Gateway Shopping Center the other day, but you guys have another location picked out yet?
I'll let Dr. Haushalter.
I'll try to yell so we don't have to keep
Yeah.
moving from there. Is that the Corps of Engineers has been here off and on over the past week. They're still looking for other facilities, not limited to one or two. Clearly, the Gateway Mall was the best option yesterday, so that's number one site, but they haven't yet named the second site. We hope that that'll be named relatively soon.
And like you said earlier, like at the beginning of the press conference, you're still trying to figure out if that other site would have non-COVID patients or COVID patients. It's kind of fluid.
Yes, and what people have to keep in mind is this is really a partnership between all the municipalities, the state health department, state unified command, which includes TEMA, as well as National Guard, as well as the healthcare systems. And the healthcare systems have to weigh in heavily. We had a call today with nursing homes. We also have to consider our seniors who are in nursing homes, where they might go. And so all of that will play together to make the right decision for Shelby County. Every community is different, so we have to have solutions that work best for our specific communities.
Dr. Haushalter, could you tell us how many care facilities were on the call today and what you said and how
So-
you can help them?
So,
Can you at the mic? I'm sorry.
Yeah, I'm sorry.
Just because
Okay.
our viewers won't be able to hear you.
that's okay, I'm sorry, my voice probably not as, doesn't project as well. I'm trying to visualize how many people I remember seeing on the phone. Somewhere around 20 different facilities were represented, and some of the people on the call actually oversee multiple facilities, so we feel like we had good representation from that community. It was hosted by myself and Dr. Jane, as well as Dr. Warren. Our conversation was about the surge, the impact or expected impact on nursing home facilities, and the unique role that the leaders of those facilities play in ensuring the health not only of the residents, but the health of their employees. We also asked for feedback on barriers that they have, what are supplies they need, what are some of the challenges they're facing, and then requested their suggestions for how to handle their patient population when the surge occurs, and then gave some tips on how each facility can manage those particular patients so that they can hopefully stay in place and not be hospitalized unless absolutely necessary.
Can you give us some of the tips or some of the things that you've recommended?
Well, clearly, individuals who work in those types of healthcare settings should wear masks all day long when providing care, even if they're not providing direct care while they're in the facility. And that's not limited to the healthcare workers. That would include the janitorial staff, as well as others who maybe bring in food or whatever services are being provided by ancillary personnel. Really paying attention to the signs and symptoms that are exhibited in our senior population. As I've noted before, they may not have a fever first. They may have other symptoms, including GI problems, as well as maybe confusion, but a change in their status could be a good indicator. And then the other is assuring that those individuals, as much as possible, are separated from the rest of the residents within the facility. It also is an opportunity to talk about end-of-life decisions. I mean, it's something that we all should think about and make our decisions and have our living wills in place, but it's something we oftentimes put off. So it's also assuring that individuals' wishes are honored at the end of their life, and how the facilities can help assure that individuals have the right to make those decisions.
I want to ask about the stores that we just mentioned. So could you give an example of a facility that's open now that would need to limit 10 people versus how many people would need to be in a grocery store? Just so we can.
So here's an example. I'll use it's a personal example. I still have to take my clothes to the dry cleaner. The dry cleaner is very small. They have a sign up, one customer at a time. So it's one customer one employee, and that employee is standing 6 feet back from where the customer is supposed to stand. So it's an issue of space and the number of people. 10 together is a good number, but if you have a very small place, that's too many. If you have a large grocery store or pharmacy, then you could have more than 10, but they have to stay 6 feet apart. My own experience, although I don't have a lot of time to go in stores right now, but when I have gone into the pharmacy, I've noticed people naturally separate. I think people are doing very good, but there's just some outliers to that. We've also received a lot of feedback that there are places of worship that are continuing to hold services that have more than 10 people. So we wanted to make sure this health directive was released before the weekend so that church leaders and religious leaders can make the right decision for their congregants.
And what about folks at home? How do they, if they see someone violating this, how can they report it?
So there's a variety of ways. One is through the 311 system within the city of Memphis, and that system has always received complaints and can triage those and send those out to other municipalities. They also have the ability to call the Mayor's Action Center for the county, and I can make sure that Joan gets that number to everyone. Those two systems work together and always have. We receive complaints in all the municipalities, but the city and county specifically receive a large number of complaints every day, and those get triaged and sent out, and so that process will continue to work for this. The city of Memphis has also spent significant amount of resources training, I'll say community ambassadors, but that Blue Suede Brigade and others, to nicely go up to people and encourage them to move on so that there will be social distancing. And I'm going to end with just noting that that is the one place we can truly make a difference. The more that we adhere to social distancing, the less people will get infected, the less people will be hospitalized, and less people will die.
Dr. Hassel, this morning the Nashville mayor kind of joined what Mayor Strickland and some task force members said earlier this week about recommending if you're out in public to wear a mask. What is your thought on it?
So we actually, as a task force, had already issued some recommendations. Clearly, there's some personnel who must wear a mask. For those who are out in public, some of it is about availability. So our statement has been, if you have a mask available, we encourage you to use that. There are some other face coverings that people may be able to use. There's cloth masks that people may opt to use. I think what I, as a nurse, really want to reinforce, it's not, the mask alone is not the protectant. It's really critical that we wash our hands very thoroughly and frequently, that we cover our cough, that we still stay apart. Having the mask on sometimes gives a false sense of security, which is why you see the guidance around masks evolving over time, because some of the research would say that people actually are more likely to get infected because they're touching their face and touching their masks. The other point is that when we wear a mask, it's as much to protect others from us as protecting us from others, and keeping that in mind that we're wearing a mask to protect others. More data indicates that individuals are infectious about 3 days prior to actually becoming ill, so wearing the mask actually protects us from that period where we don't know that we're sick and we can spread it to others inadvertently.
Dr. Renoff, if I could follow up, thanks Dr. Haushalter. If I could follow up, so when you're saying closing of business, are we talking you're shutting it down for a month, permanently, indefinitely? For these violators moving forward, when you say close them down, what kind of time period are you thinking?
Time period would be to which time that, one, I feel that they are compliant, and secondly, if to the point, it can extend to the point in which there's no longer a public health threat. So with them being compliant would mean that they would have to demonstrate to me that they no longer represent a threat to the public's health.
Time can vary.
So it can vary, yes.
How many calls have you been getting from people, like a rough estimate of how many people have been calling saying, hey, these businesses are still open, people are inside them?
I think I received 3 this morning prior to coming, pertaining to, someone was,
About people hanging out inside actual restaurants?
Well, not actually hanging inside an actual restaurant. most of the complaints that I've gotten, and it's one of the reasons why I wanted to highlight the essential businesses that continue to operate. Some of the complaints, probably most of the complaints, have come from employees of these businesses because the employer is not practicing social distancing or providing PPE. And so that is why I am emphasizing to them, you're exempt because you're essential, but if you violate the directive, you will be closed also.
Dr. Randolph, you'll take one more question.
I wanted to ask, have there been any update with the assisted living facility? Were there any more cases tied to that facility, or anything more new with that?
Not at the current time, but we're still working with that. I want to add one comment. We will have a press conference tomorrow here at 2, and then beginning Monday, we'll do it jointly as part of the task force, and we'll be doing that at the library using technology. So Joan will get that out to everyone before Monday. We anticipate it'll be in the afternoon, but the time may need to change to be able to accommodate others who would be working with us on that. So thank you all for being here, and we'll see you tomorrow at 2.
From somebody else that says, can you see if Larry can help you? I don't think Nick can do that. But I will.
It recorded, you click that.
I'll send it to the shop. And see if you say that this one's stop this.
I'm assuming that you could, if you get on, not, yeah, but the goal would be not to have this. Oh, yeah. That's not. But, and that usually is.
Yeah, we're live.
We'll have to.
It just, when it comes back to the office, I'll see if we can save it on the phone. We may be able to edit it, but it may just be that, which we still, it's saved onto, Facebook, but I don't know how to save it. So when we come back, I'll do it. But we got it. We good. But when it's tomorrow, don't touch the screen. Don't touch the screen. Yeah, you gotta make sure you save it first. Just be careful. Yeah.
Providers know, right, they know that we don't get things after the pull. And so we find out about it the next day. So it all, it's just, it's not an issue of somebody doing anything wrong. It's just that we have to move it in a certain point in time.
When I released it in the hatch, well, that's what I did.
Yeah.
Yeah,
I mean, they did.
because we have to have time to process it all. So we're working on it.
I'm just wondering.
Well, you can see what happens.
Yes.
We're
So,
always one day.
I would say look at all of how we
Today's
built
number
up an
is
institution.
what we pulled yesterday.
Including from the very beginning, that is partnered with us.
It's not all.
That we did that together.
But
So subsequent to that, Ladonna released something on her own. It was a very similar conversation. We work with them all the time. It's like, do you want to come to the press conference with us? How would you like to handle it? It's best to be transparent, and that's what they did.
I don't know exactly what the number would be today.
You had other elected officials that didn't like their own staff, and we haven't been able to do that because they were
What we
chosen
pulled
to
today,
be transparent. So I would just say,
after the day before yesterday. And so these statements, our study is 6:40 is the number.
well, that may be their internal decision.
Then they wouldn't have had to say it if you would have said it. You wouldn't have put it in the procedure. Yes.
Yeah, we ended the day with, we're gonna be compelled to share this information, later today, that one, right?
I get it. I just wanted to double check to, like.
And with the second case at the distribution center, are you, the Kroger distribution center, are there are y'all recommending do a bunch of, so there's like 400 workers at that center?
We wouldn't necessarily do that, and one of the things that we have done is create what's more of a strike team, so what we anticipate is that you'll have more mini outbreaks, and so we have to take our efforts and focus on those outbreaks to stop transmission in groups, and from those decisions of the strike team, we make recommendations, so there'll be variability, but at the current time, we haven't said, oh, you need to do X, Y, Z with that particular group.
Because Carriage Court, when that second case happened, you all got involved, that's why I asked.
Well, we were involved with the first.
Oh,
And we
gotcha.
had given instruction with the first, and they had adhered to that. And so you expect with adherence to that instruction that you have no more cases. So when you have a second case, that's a red herring, that something's not right here. What does that mean? Does it mean that there was always 6 people that weren't picked up before? Does it mean that there's ongoing transmission?